Hi folks, welcome to another day of Cancer Healing Vlogs. So today is the what is today's date? I don't remember today's date as well. I'm so lost now. Today is Jan 11th. It's an important day. Well, I'm getting very close to my exams, and there are so many topics that we are studying throughout the day. We're just going through multiple different, uh, randomly jumping from one topic to another, so that just it all kind of assimilates like all these 3 years what we've been studying tidbits here and there. We are kind of I'm trying to assimilate that as much as I can. This is the fun part where you get to where you get some time where you can actually uh, absorb as much as you have to, and your professors and even the juniors that are very helpful. They're trying to they're supporting you to make sure that okay, you get to learn as much as you can. And so it's a beautiful journey, and thesis work being done now. Now the only focus is on learning. There's so many different aspects that we need to cover, from the histopathology, hematology, then different allied subjects like micro, blood bank, and then molecular level studies, and then as much in depth as we can. Of course, clinical. There's biochemistry, then there's clinical pathology, then there is staining, there is gross, different things. So it's fun getting to learn as much as intensely as we can. Today I will cover one topic which I had studied a while back, but it's definitely a very good topic, and I kind of revised it just for this particular session. So it's plasmacytoma. Okay, so plasmacytoma is what? It's basically it's like the benign, or it's not benign, it's the earlier version of multiple myeloma. Multiple myeloma is when it kind of becomes full blown. Plasmacytoma is like especially the solitary plasmacytoma when you're talking about it. So in solitary means there's only like one plasmacytoma. Now what is it? Plasmacytoma is like there's like a lesion. Now it may be either on the bone, or it may be extra medullary outside the bone area. The places, if it's in the bone, it will the lesion will have it will be in the like the vertebra, ribs, the mandible, all these, this basically the skull. These regions the plasmacytoma can be, but if it's in the extramedullary, it may be in the lymph nodes of the cervical, the nasopharyngeal region, then also in the as a psoas abscess. That can be one presentation that we've been told that as it's a possible presentation of a plasmacytoma. So how do you diagnose it? Basically, in multiple myeloma, for diagnosis, you need to know what is for multiple myeloma, and if you know that, then you kind of know that it's not a plasmacytoma because you've ruled out. So in multiple myeloma, you require IgM to be raised in the serum or the urine. Okay, and in multiple myeloma, another thing that you need to know. So in multiple myeloma, that's raised. In plasmacytoma, it's raised, but not as much. The more important thing is the CRAB, C-R-A-B. C for hypercalcemia, not there in plasmacytoma. R for renal dysfunction, not there in plasmacytoma. A for anemia, again not there in plasmacytoma. B for bony lesions. Now, lesions in multiple myeloma. In here, there's only, since it's solitary, it's one lesion. So that's one thing. And in the lesion, there will be plasma cells just like in multiple myeloma, and the plasma cells will be of all kinds, immature to mature, blast level plasma cells. And sorry if that wasn't very clear. These are the different forms that can be observed when you're talking about a plasma cytoma. The I talked about the M protein, but there's also the these immunoglobulins, the IgD, IgA, and IgG. In multiple myeloma, it's a polyclonal. So these different IgGA, they could be raised. In plasmacytoma, it's usually it's monoclonal, so only one of them. And within them also the kappa or the kappa or lambda chains will be raised. The rest will be normal. So it will either be one of them within the IgG or IgM. So different patients have different presentations, and generally it's IgA is if I'm not wrong, IgA is very common. I need to clarify on that, but there's there are studies done on whichever one is higher, and within them the kappa and lambda chains will be also, one of them could be raised. So that's a typical feature of plasmacytoma. So you can now recognize what is when you diagnose, and for knowing that there are no multiple lesions, do an MRI. So then you can see that, okay, in multiple myeloma the lesions are spread all over, and that's how you know it's a plasmacytoma. Sorry, if it's multiple lesion, then it's a multiple myeloma, obviously. That's for differentiating. And plasmacytoma starts, it can later on progress to a multiple myeloma. In fact, 50% actually do progress to a multiple myeloma, and that's one that's one factor that one needs to be aware of. What else? Yes, there is these markers, the CD markers used in the flow cytometry, CD38 and CD138. Those are the numbers for the plasma cells. And yes, immature plasma cells, they have that, they may be multiple multi-lobed as well, which is not there in a regular plasma cell. So that is also seen here in a plasmacytoma. Although I think those can also be seen in multiple myeloma. In multiple myeloma, one more important thing is there, that in the bone marrow, there is presence of more than 20% plasma cells. Now, in a plasmacytoma, the bone marrow is fine. There is no involvement of the bone marrow. Important factor to be known. So these are some features which you will easily just help you distinguish, give you write notes about plasmacytoma as well as write notes about multiple myeloma. So in a way, I've also covered multiple myeloma for you. And yeah, so the topic is both plasmacytoma and multiple myeloma, because those features are been pretty much covered just now as I shared the difference between the two for you. So hope this gives you some insight into these two diseases. Both are ultimately tumors, and they can, lead to all the, if they metastasize, then they are causing further damage, and it could lead to eventual death. So serious diseases and need to be diagnosed, need to be understood, thus treated well on time, obviously. Hope this gives you some insight. Cheers. Take care. Bye.